World Health Watch is brought to you by B&D Claims.
Good evening. Today's World Health Watch is focusing on World Toilet Day. The World Toilet Organization was founded on November 19, 2001, and continues to be recognized yearly on that date. World Toilet Day was founded to draw global attention to the sanitation crisis which still exists today. The numbers are astounding. For example, the World Bank's Water and Sanitation Program assessed the annual impact of poor sanitation in selected countries. This was done in 2008 and 2012. Selected countries such as Nigeria, the impact was 1.3% of GDP, or $3 billion US. In India, 6.4% of GDP, or $53.8 billion US. In Cambodia, 448 million US dollars, or 7.2% of GDP. In Liberia, 2% of GDP, or $17.5 million. Additionally, in Indonesia, 2.3% of GDP, or $6.3 billion US dollars. The economic causes and effects of poor sanitation can be costly, an estimated $260 billion US dollars a year. The issue was highlighted again this year on November 19th by the United Nations in hopes of bringing attention to accessible, healthy waste disposal. The United Nations has recognized that there are 2.3 billion people who don't have access to a proper and private toilet. Of that, almost 1 billion defecate in the open. 314,000 young children's lives could be saved each year by clean water, sanitation, and good hygiene. Worldwide, more people die from unsanitary conditions than from AIDS, malaria, and measles combined. For every $1 invested in eliminating open defecation, there's a $6 economic return. For every $1 spent on sanitation, there's a $3 return. 272 million school days will be missed by children each year due to diarrhea, and girls, especially when menstruating, are reluctant to attend school if there's not a proper and private toilet to use. In low-income countries, on average, only 46% of schools have toilets for their students. And last but not least, in Canada, more than 65,000 people lack private access to home toilets, in part because of poor infrastructure and housing in many Aboriginal communities. This is Beverley John, reporting on behalf of Afro Mosaic Health Guide for World Health Watch.
You're listening to Afro Mosaic Health Guide live on AM 530 Radio Alif. We'll be right back in a moment.